Hey everyone, I'm Scotty from Scotty RNY, and this is my week 31 post-op Roux-en-Y gastric bypass update. How's everyone out there doing today? As of course, as always, as I ask you guys, I hope you guys are doing well. Because everybody, how am I feeling? Fantastic. I am fantastic. All right, let's hop into some numbers for you. So I am 6'2", 45 years old. My highest weight ever recorded was 419 pounds in August of 2014. I had surgery July 7th, 2015 at Humber River Regional Hospital in Toronto, Ontario, Canada, and my surgeon was Dr. Hagen, and my surgery weight was 340 pounds. Last week I was 221.6 pounds, and this week I am 221.4 pounds. So I'm down 0.2 what I had gained from the week before. If you had seen my videos 2 weeks ago but you didn't see it last week, I actually went up for the first time in a long time. Anyways, so I am back to where I was my lowest, 221.4, which gives me again from surgery 118.6 pounds, and my total weight loss from my highest ever recorded is 197.6 pounds. It was a somewhat normal week. I still did some weights. The gym, did the cardio like I like to try and do. So I guess I was just lucky to lose that weight again. We'll see how this week goes. Maybe I might have to actually really pay attention to what I'm doing or what I'm not doing. Is it the weights that I'm doing that might be causing the stall weight gain, or am I actually eating that much of bad food? That could be a bit of both. There's the train. I'm going to have to stop recording at this time of day, I think, really. So, of course, as always, there's my chocolatto. Thank you. Thank you very much. This past week, we had a support meeting here in town, our once-a-month support meeting. And again, it was good. We got to see, the people that we don't see. And there's a few new people there as well. There was one woman there. She was new, and she wanted to know more about how our clinics worked here and what to expect. And she was kind of under the assumption that they do everything for you here at the clinic. Post-op, as in your dietitian, your nurse practitioner, your social worker. She even thought there was going to be a trainer. Now, I don't know if she had just heard this somewhere and was understanding that, or just her own belief. And here, we have access to all that except the trainer. Because beforehand we see the dietitian, the nurse practitioner, and the social worker, and we kind of told this lady how, again, this surgery is a tool, but we still have to help ourselves out there. We can't rely on others. They're there if we need them for support or help, but we can't rely on them. We have to do this for ourselves. So as far as not having a trainer, we have to know what we need to do. Now, the dietitian can kind of help you, or even the nurse practitioner give you some ideas of what you need to do. Otherwise, it is left up to you, because again, this is your tool and you're to use it to the best you can. So I think that was a bit of a surprise for her, but again, it was good for her to know that, and she was thankful that she asked those questions and got to know that. I had a proud moment. She made me feel good. She thought I looked like I might have been about 5 years post-op, because she said I look fit. That was a beautiful thing to hear. So that was really nice of her to say that. So of course I blushed, because I blush easily. So otherwise in the meeting, everything else went well. And the usual just talk around the round table, how's everyone doing, and struggles or this or that, and getting past them and how we can get past them. And that was the main thing too. Let me see. Kind of a weird NSV, I guess, in a sense. I had to go buy a shirt for a function that I went to on Sunday, a dress shirt, and the dress shirts that I had just got at Christmas time was 17.5-inch neck. So naturally I went, to the store, grabbed one off the shelf, and off I went. Came home, put it on. It's a little too big. It doesn't look terrible. It's not like my other Omar Tent Emporium fabric that I have, but it was a little too big. So I was surprised. So maybe I'm down to a 17 now. but again, I'll still wear it like I have to. And as far as this function that I had to go to, hi, my name is Scotty, and I'm obsessed with WLS. And I don't know if anyone else out there is, but, excuse me, but I am. I'm obsessed with talking to people about it who already have it. So at this function, we were all out, having dinner, and there was one person there who had had this surgery, and she was around the same time out as I was. And I must say, it was brought to my attention, and I'm glad for that I kind of ignored the rest of the other people, which I was supposed to be engaging with and involved with, but I didn't because I got so caught up in talking about the WLS life and how we're doing and whatnot. And yes, it did seem like it was pretty much a support group meeting because of the way that the two of us were talking back and forth. So I find that I get caught up in that situation when I'm talking to people about this, because it's a common thing that we have, and there's not a lot of people out there in the world. There's a lot of people, well, there's a few people out there in the world now, but not a lot. But when you happen to run into someone and interact with them about it and how they're doing, whatnot, you just have stories and stories to tell and whatnot. So, and of course, I'm only 31 weeks out, so I'm still in the newlywed phase of it all. And that might be part of it too. So I apologize for kind of ignoring the rest of the party people because I got caught up in my own little world of WLS. So that can be a bit of an issue. I think I'm going to have to pay attention to from now on when I might happen to come across someone that engage with the WLS talk and whatnot, and step back and go, yeah, no, I can't be talking like this if I have something else that I need to be paying attention to. So that was unfortunate, but I'm glad that it was brought to my attention so that hopefully there's no next time with that. Let's see. Oh, I made a cinnamon raisin cloud bread toast. Yeah. Well, I made the cloud bread. So it's cinnamon raisin cloud bread, and then you cut it and you toast it, and you put butter on it, of course. And how did it taste, you ask? It was delicious. Yes. If you haven't heard of cloud bread, you're on YouTube anyways, just look it up. You'll find a couple about the same recipes anyways. All I did was I added cinnamon and raisins to it because yesterday morning or the day before at work, somebody was having cinnamon raisin toast. And I'm like, oh, this smells so good. I don't know if I want to make that or like buy that and do it. So I was like, I'll make it with that cloud bread. So I made the cloud bread, incorporated that stuff into it, baked it up. Came out like a loaf of bread kind of ish, like cloud bread does, and sliced it up and put it in the toaster and put a little bit of butter on it. Delicious. So that was my food for the week. Nothing else really crazy going on. That's about everything. So again, I would like to thank all my new subscribers out there. You guys are absolutely fantastic. And everyone else who's been hanging around still, I appreciate you guys just the same as well. And to the people out there that I'm watching and I'm trying to keep up, you guys, again, are fantastic. And I'm glad that some of you that have been struggling with certain things, whether it be mental, medical, or whatever, are starting to get past that and getting on with this whole journey and starting to enjoy it. And that's the main thing. Really, really it is. So if you would like to like my videos and everyone else's, that would be greatly appreciated. And if you want to share the video however you'd like to share, go ahead and share the video. And of course, as always, if you want to be in touch, you can contact me with Google+. So that's going to be about it for this week, everybody. Thanks again for watching. We'll see you again next time. Take care, and bye-bye.